Welcome into a Monday edition of Wave Listens Live. I'm Michael Vanover at our new time, 12:30. We're going to be with you Monday through Friday from 12:30 to 1, so we appreciate you making us part of your day. We've got a great show planned for you as always. We'll take a quick look at the rundown here, and then we'll jump into our first segment. We're excited. Today, coming up on Listens is Louisville Civic Orchestra. The Derby Soundstage is going to be joining us as well. Looking forward to that, but starting with Cornerstone Wellness Center. Dr. Kane, Dr. Doug Kane, and Angela Dyer is joining us from Cornerstone. Welcome in.
Hey, thanks for having us, Mike.
We appreciate it. Thanks for being with our new show at 12:30.
I know.
It's exciting stuff. That's right. Well, we're glad to have you on first. It's going to be a good one. So for the folks at home, Dr. Kane, that are not familiar with Cornerstone, could you give us a brief overview?
Yeah, so been in chiropractic practice for 31 years, and I've actually, because of the show, had people ask, well, hey, can I still get chiropractic care there? Yes, that's the main thing that I've always done. But in the last 6 years, we have gotten involved in neuropathy reversal at our office in New Albany. I am, I believe, still the only doctor of any kind in this area that is board certified in neuropathy reversal, and we've got a lot of experience. This just kind of fell in my lap because my mother was diagnosed with neuropathy and had asked, hey, is there anything that can be done for this? And I, like all of my counterparts, medical doctors as well, were trained that no, there's nothing that can be done for neuropathy. It's a progressive, degenerative neurological condition. There are some things that focus on treating symptoms, some medications, but over time, as those escalate, they get into some side effects and so forth that are difficult for people. So we concentrate and focus on the cause of the neuropathy and treating that and helping people heal naturally.
You know, Dr. Kane, if you would, talking about neuropathy, people have heard that term. You obviously just kind of explained it again, but you're a lot smarter than me. So if you would, for people at home that maybe they think, do they have it, do they not? What are some things that they could look forward to saying, you know, this may be what I'm suffering from?
So very simply, what neuropathy is, or more specifically peripheral neuropathy, is where the peripheral nerves in our extremities aren't communicating with the brain properly, so we get abnormal sensation. Many times that's pain. It can be temperature-related issues. They feel like their feet are on fire or they're just frozen all the time. They can feel pins and needles. Remember how when you were a kid you'd fall asleep on your arm and you'd wake up and you'd feel the pins and needles? They feel that a lot, and it's very annoying. Difficulty sleeping because they can't stand the covers to touch their feet. Any type of surface stimulation is
Numbness.
difficult.
I mean, there's all kinds of things, right?
Numbness would be the absence of all of that.
Yeah.
And then the biggest issue is the fall risk. A lot of falls because they're not getting good feedback from their feet, and it also affects the hands, the dexterity of, you know, things like buttoning and zippering and writing and so forth. So it can affect your daily, have a big impact
in
on
a big
your daily,
way.
Yeah, for sure.
Well, and you brought Angela with you today, which we're so excited to have you here with us, Angela. Thanks for being here. And you know, if you would kind of introduce her a little bit for us, Dr. Kane, and talk about, you know, her role at the office.
Sure, she's the real star in the office when it comes to neuropathy. So no, we've worked together for many years. She is our neuropathy coordinator and case manager and is just excellent at it. So she is who you'll primarily deal with in the office when we're going through your exam and consultation. It also includes a set of full spine x-rays, and then she and I will sit down and go over the test results and the case history and determine what's the best plan for that patient.
You know, and Angela, if you would kind of give from your perspective, especially people again that are watching right now that maybe are thinking, should I call, should I not, or I'm suffering from that, or I think I might be. What would you tell them? Because it's, you know, it's never too late to get help, right?
I would say call right away.
Yeah.
Because, like Dr. Kane said, neuropathy is a progressive degenerative neurological disease. Left untreated worsens over time, and oftentimes we see the effects of that whenever people come into the office. Typically, if pain is their main indicator for their neuropathy, they'll typically move a little bit faster than they would if it was just numbness. And just to touch on what Dr. Kane said, oftentimes one of the very first symptoms that people will see is they'll feel like they have a wrinkle in their sock or a pebble in their sock, and they'll take their shoes off and there's nothing there. That oftentimes is the very first sign of neuropathy.
Well, and you know, people say things like life-changing, and it gets thrown around a lot. No, this is life-changing, right? I mean, you've seen people come in and get help, and they're a different person after they've been working with you for a while. Dr. Kane, what are some of the different options that they have when they come in, the different things that you guys do to help with peripheral neuropathy?
Well, the first thing is to start with the root cause. The most common cause is diabetic peripheral neuropathy. My mother, the second most common common cause is chemotherapy-induced neuropathy. We have what I would group as orthopedic-related. So they've had neck, back, other spine injuries, surgical issues with hip, knee replacements, or foot injuries. So then we can also get into diabetic or alcoholic neuropathy, exposure to poisons, Agent Orange with our veterans. We've had exterminators and so forth, farmers that deal with a lot of chemicals. So those are the kind of things. So we got to get at the root of the cause, and then we will custom design a program around that. We use FDA-cleared devices, and I think it's important to note, because we're dealing with the population where mobility is an issue, the lion's share, 90% of our treatment program is designed for them to do on their own in the comfort of their home. So it's not invasive that they've got to keep coming into our office repeatedly. We explain to them what to do, train them what to do. We touch base with them frequently, but then we, they're able to do that where they're comfortable.
Okay. Angela, if you would, somebody calls in today, and
Yes.
like Dr. Kane said, they normally deal with you. Take us a little bit through the process. When you get them on the phone, how long, oftentimes until they get in? How many times do they come in? How long are they there for? Just, answer some of those questions for us.
Oftentimes it will be myself or our staff, Ireland or Kristen, that will answer the phone, and we just come along beside the patient and find out exactly what it is that's bothering them, how long they've been suffering with the symptoms, and oftentimes we'll let them know Dr. Kane's success rate in treating neuropathy patients, so they feel comfortable in a setting where people have been successful in receiving treatment.
Yeah, and you can always give them a call at 812-949-0900, mydrkane.com. Dr. Kane, what do you, when you look at all the patients that you help and the differences that you've made in their lives, what are some of the biggest hurdles that you've seen when it comes to helping people?
The absolute biggest hurdle is everybody believes that they've been told repeatedly there's nothing that can be done. And that is not true, and that is why we're here, and we appreciate everyone that listens for helping us get this message out over the years. Some people, they want instant gratification. This is a disease that takes 50, 60, 70, 80 years to manifest itself. It's going to take a few months. This is not going to be where you're going to see changes in a week. We do have patients that do that occasionally, but it usually takes, this is a week or months, or sometimes it can be, 12 to 24 months before we're seeing complete resolution to the best that we can.
No doubt.
And that's why it is so important to start early at the first sign of symptoms, because the longer it stays around, the more permanence there could be.
All right. Angela, before we let you go, tell the people at home what's the best way to get in touch with you.
812-949-0900.
That's right, or mydrkane.com.
Yes.
Angela, Dr. Kane, thanks so much for being here today. We really appreciate it.
Thank you.
All right, we've got
you
more
so
to get to when we come back on Wave Listens Live. Stay with us.